If I could give one bit of advice, I would say go for it. Being a paramedic is a fantastic profession. The course affords you an opportunity to put whatever you've learned into practice in a clinical setting. There's a really strong relationship between the university and London Ambulance Service. You will do your placements on an ambulance during your time at university and can then be a part of your employment when you graduate. I'm James. I studied the Master's Pre-Registration Paramedic Science course here and I graduated 3.5 years ago. Being a paramedic's a really diverse career. You can work in a number of settings. Since I graduated from a paramedic science degree, I applied to work for London Ambulance Service. The course was linked with the London Ambulance Service, so I'd held a role part-time with the trust during my time at the university as a student, and that segued me into working full-time as a newly qualified paramedic with them. After a time of doing that, I applied to the university when a teaching role came up, and then was able to move into doing that and having that running alongside my role with London Ambulance Service. You will do your placements on an ambulance during your time at university, but you'll also do placements in GP practices, A&E departments, prisons, community teams. That will feature as part of your course and can then be a part of your employment when you graduate. There's a really strong relationship between the university and London Ambulance Service. So they have a training centre just opposite the university that the university uses, and that London Ambulance Service also uses the university's facilities. So students get to know the teams and the people they're working with while they're out on placement, and then they can fit into that environment when they graduate quite well. Ultimately, in the future, I would like to end up in some role coordinating education for paramedics and student paramedics that are coming through the system, where I can oversee some teaching, research and clinical governance for people coming into the early stages of their career. There's a really broad variety of people that teach on the course. There's a number of paramedics, but there was also a number of people from other medical specialties. So we had some midwifery specialists, we had some nurses, some doctors, some operating department practitioners who were all involved with the teaching on the course. The support for learning different areas of healthcare was fantastic because it came not only from paramedic teachers who are generalists in terms of medicine, but from specialists as well, from different disciplines. So there was a huge level of support across a whole range of what we needed to learn, and from the students to each other as well. If I could give one bit of advice, I would say go for it. It's a fantastic course. The course affords you an opportunity to put whatever you've learned into practice in a clinical setting. Being a paramedic is a fantastic profession. You have a really high degree of training to provide care to patients across a range of environments.